Well, hello there and good evening. It's a Sunday night. Actually, it's Super Bowl Sunday, and I have no interest in watching the Super Bowl. So I thought I'd come and make a video. If you're going to watch one video that I ever make, this should be the video. I do my channel for fun. It's an uplifting channel. I do unboxings. I do aisle of shame at Aldi's. I'm going to add some other stuff. I do weight loss, or I'm starting to do a weight loss weekly video. Anyway, this video is a little more important than that. I wanted to do a get to know me video and have people ask questions. I don't think I have enough subscribers for that, and I don't know if enough people would watch the video for that. So I thought I would make this video, let you know something that has affected my life. It was very negative, but it affected my life in a very positive way. And I wanted to share it with my subscribers and anybody that watches my video. So on with the video. Let me get comfortable. By the way, welcome. My name is Christine. Welcome to my channel, Christine's Corner, where I do unboxings. I'm going to do a little chit chat. I'm trying to lose some weight, so I'm doing a weight loss video weekly. And Trader Joe's finds and Aldi finds and whatever else I might think of that sounds interesting. So let me get comfortable. I have my yoga pillow here, cup of tea, and I have a little table here. Thought we could get cozy on a Sunday night and have a little chit chat. So anyway, what I want to talk to you about is 10 years ago, actually December 14th, 2010, I was diagnosed with endometrial cancer. Was told that it would be a hysterectomy, and that's all the treatment that you need for endometrial or uterine cancer. So after I got diagnosed, my gynecologist wanted me to go to a referring doctor that she was going to refer me to. And when I got diagnosed, and I didn't write any notes, I want this to be natural and just kind of flow. So if I stutter or I stumble, I don't know, just bear with me. I'm going to try and make it short and sweet. And then if anybody has been diagnosed with cancer, knows anybody that's been diagnosed with cancer, has any questions for me, I will answer anything for you. But just bear with me if I stumble and stutter. I just want to do this in one take. I'm not good at editing, but I want to get this video out there. So as I said, I was diagnosed with uterine cancer in 2010, December 14th, 2010. So, of course, you tell your closest circle of people about your diagnosis. So I had told, I was at work when I got the diagnosis. My gynecologist called me at work and told me over the phone, stage 1 uterine cancer. Don't worry about it. Not a big deal. Hysterectomy and done. Well, easy for a doctor to say, right? When you get diagnosed with cancer, your head spins. All you're thinking of is the worst. I'm going to die. I'm going to die. So I had to leave work, of course. I work in an office. I work in the financial field. So I left work, came home, head was spinning, didn't know what to do. My sister works for research doctors. She works at a facility and she takes care of all the research doctors that do research. So she told me, get all your records. I got all my records, gave them to her. She went to work, went in a boardroom, put all the records in front of the doctors, said if this was your mother, your sister, your aunt, your wife, anybody that you loved, where would you send them? They all said a particular doctor that works at a cancer center here in our town. So I was like, okay, that's where I'm going. Well, wait a second. Let me backtrack. See, I'm not scripted. So I also had spoken to my good friends. And one of my good friends is Tammy from Tammy's Ageless Beauty. And if you watch her channel, you know that her husband is a doctor, urologist, completely different field, still a physician, knows a lot of stuff. So I had told her and she had told him, and when she called me back, she had told me that He's named the same doctor that my sister's doctor's named. Well, if doctors are telling you where to go, that's where you go. So my gynecologist had said, when I was diagnosed, I was 46 years old, and she said, you keep your ovaries, it will make going through menopause much easier. I'm just taking in all this information, probably taking in a quarter of the information and not really digesting it. So with that, I decided I'm not going to go to the referring doctor that she referred me to. My sister got me an appointment at this cancer facility on December 21st. And they told you expect to spend the whole day because you go through, anesthesiology, you see the surgeon, you go through a whole litany of different offices, and they get you scheduled for surgery. So my surgery was scheduled for January 2nd, 2011. Went in, had the hysterectomy, came out of the hysterectomy, came home. They said, okay, everything looked great, took everything out, ovaries and everything. This doctor that I went to at the cancer facility, I'm backtracking a little again, I know, but he said, take everything out. You're not going to have babies. If menopause is a little harder, so what? He is the expert. I listened to him. So everything came out. Full hysterectomy. Radical, do they call it? I don't know. Full hysterectomy. So went back for my 2-week checkup after the surgery, and doctor came in, looked me over, checked all my scars or my, wounds, said, you're healing beautifully. Everything looks good. You look good. You still have to take time to rest. This is a major surgery. And then at the end of the visit, of course, the conversation turned to, well, you're a little bit of a different case. He said, when they did the pathology, they found cancer in your ovaries. Well, again, the head is spinning. What? So, hold on one second. I have my cup of tea here. Sorry to, I'm just going to take a breather for a second. This tea is delicious. I brought the container. I used up the last of it. I hope you can see it. It's David's tea. It's turmeric glow. Excuse me. Turmeric glow. I can't even talk. Anyway, good thing we're all friends here. And this is delicious tea. I love David's tea, and I love to drink tea. This is caffeine free in the evening. Warms your heart, warms your tummy. Let me take one more sip. So anyway, back to my story. This physician said, everything out. He took everything out. Now, the pathology came back. You have ovarian cancer. Then he followed up with, you're very lucky. It's stage 1, but it's stage 1B. My uterine cancer was stage 1A. So I really did get a big schooling in gynecological cancers. And the best way he described stage 1B ovarian cancer is that B means the cells are crazier. They want to get out. They want to get all over your body. So he said, unfortunately, now you're going to have chemo. Oh my gosh, chemo? What's chemo? I don't know what chemo is. I've heard of chemotherapy. I've heard of cancer patients. I've known people who've had cancer. But if you don't have chemotherapy or go with someone who has chemotherapy, I don't know that everyone knows what chemotherapy is. So I believe it was February. So January 2nd was my surgery. I believe February 1st or 2nd was my first chemotherapy. It was 2 weeks after my 2-week follow-up. So I was 4 weeks post-surgical when I started my chemotherapy. And the chemotherapy was 6 rounds to last 6 months. I went every 3 weeks on a Tuesday for approximately 6.5 to 7 hours. Yes, 6.5 to 7 hours. Gynecological chemotherapy, ovarian chemotherapy is some heavy duty chemotherapy, let me tell you. So I started the chemotherapy. The first chemotherapy went fine. And then the second chemotherapy came and I got phlebitis. The third chemotherapy got phlebitis again. They said, well, we're going to have to put in a port. So they put in a port for the last 3 chemotherapies. And I didn't realize, but chemotherapy, you go in, every time you go in, you get weighed, and then you go, and then they, put the needle in, they get you all set up, and they go and mix your personal cocktail of whatever the doctor has recommended. And I had 3 bags. I had Benadryl first. Then there was a chemotherapy bag that lasted, I think, about an hour, hour and a half. And then there was one that lasted 4.5 hours. So you figure by the time you get there, get checked in, get set up, they put the Benadryl on. That was a half hour. Then another hour and a half. Then another 3.5, 4 hours. And, you sometimes have to wait in between, etc. You're there 6.5, 7 hours for your chemotherapy. Anyway, the point to all this is, I'm getting to it. I am now, on May 17th, I'm going to be 11 years cancer-free. So what I'm trying to get at is, if you are diagnosed with uterine cancer and your gynecologist tells you keep your ovaries, don't just automatically keep your ovaries. Listen to my story. Make your decision for yourself. It wasn't that rough to go through menopause. Yes, did I have to go on chemotherapy, which completely changes your hormones? Did I go bald? Yes. Did I care? Absolutely not. Was I hotter than hot every minute of the day? Yep. Sweating, went to work, tried to go to work every day. It was not easy. The side effects that I had were that my legs ached and, mood swings. They put you on steroids now, dexamethasone, I don't know. So I was like, oh, I'm going to have chemotherapy, I'll lose weight, trying to keep upbeat or just be silly. And the nurses laughed at me and said, no, you're going to gain at least 14, 15, 20 pounds. They were spot on, let me tell you. My face blew up like a balloon. I'm going to have a picture on the thumbnail. You'll see what I looked like. I thought I would never share that picture with anyone, but I was taking pictures when I looked like that so I would remember what I did go through. And I'm going to share it because I want to share it in case anyone you know, anyone you love, anybody in your circle gets diagnosed with cancer. It could be any type of cancer. I'm no doctor. I'm not giving recommendations. I'm telling you my story so that you know what happened to someone else out there so that you can make an informed decision. I'll tell you, the first chemotherapy that I went to, my mom was in the waiting room. My husband worked an odd hour job, so I didn't want him to take off to take me to my first chemotherapy. My mom took me, and she was talking to a woman in the waiting room for chemotherapy, an older woman. I would say she was in her 70s at the time. And they got to talking, and my mom had told her, I'm here with my daughter, and she's, she had uterine cancer surgery, etc. You don't need to hear the whole story. And the woman said, oh, God bless your daughter. She's so lucky. She said, I had surgery. I had uterine cancer. I don't know how many years ago. Maybe she said 15 years ago. She said, and now I have ovarian cancer. And I wish I would have gotten a full hysterectomy because now I wouldn't have ovarian cancer. She said, they're just keeping me alive. It's just a matter of time. There's no cure. I'm too late stage. So it doesn't happen to everyone. My story is probably not a common story or one that you hear every day, but it could happen. It happened to me. It could happen to someone else, I'm sure. They never find ovarian cancer, they told me, at stage 1. It was basically some sort of miraculous intervention, honestly, and I really feel it was some sort of miraculous intervention because I actually am lost for words right now. Let me have a sip of tea. Delicious. Anyway, it was some sort of miraculous intervention. I'm certain of it. The doctor that did my surgery, of course, then you have to go for follow-ups, after you're done with the 6 months chemotherapy. Then I had to go to the doctor every 3 months. Then after a while, you get up to every 6 months, etc., etc. But the physician told me if I would not have had my ovaries out, because there are no major warning signs for ovarian cancer. There is a blood test that you can have done, which is a CA-125, which I don't know why for women, it's just not a standard test, but it isn't. It measures some type of antigen in your blood that is a precursor for ovarian cancer. But he told me if you didn't have your ovaries out, you most likely would not be here in 5 years. So in 5 years was now 6 years ago. So that is my story. I'm considering myself blessed to have been diagnosed with uterine cancer, for them to find the ovarian cancer, to go through all that, to make me a better person. I am more empathetic. I'm just different. I enjoy life. I've always enjoyed life, don't get me wrong, but every day is a blessing. Find laughter, find fun, find love. I know we're in the middle of a crazy time right now. I don't go anywhere because I have lung issues as well. I'm waiting for my vaccine. But anyway, just find happiness in whatever life throws your way. I've been thrown a lot of curves. Cancer was, I want to say, the biggest, but I survived it. I'm here to tell my story. I've been wanting to tell my story. And I hope this gets out there to as many people as possible because I think it's a good story to tell. I now sit on the board of patient advocates at the cancer center that I went to. So a lot of the people that sit in on the meetings, different physicians, etc., caretakers, nurses, hear my story. And everybody is like, you know, there's a lot of stories that we hear on the board, but this is one. I feel like I'm fumbling now, or maybe I'm going on and on too long. But anyway, the point of this is I had a fabulous support system. My husband, my sister, my mom, my nephew and my nieces, I think were a little too young to completely understand what was going on. Great friends. I had a friend that took me to multiple chemos, a couple of friends that came and sat with me at chemo. My mom took with me and sat with me at chemo. My sister took me everywhere. My mom took me to breakfast 2 or 3 times a week. The people I work with, the people at my office, unbelievably supportive. You can't imagine the support system I had. And a friend of mine once told me, you are the one that is diagnosed with cancer. You're the one going through the treatment. But remember, everyone that loves you is going through it too. And that has stuck with me the whole time. So I tried to keep an upbeat. I mean, it's hard when you are feeling like I was in bed all weekend up until Monday or Tuesday after my chemo. So you're going through a lot of pain, but you're fighting for the other side of that. So I hope I'm not rambling too much. I hope my story has made sense. I want you to please ask me any questions. If you've been diagnosed recently with any cancer, I can't, give you a diagnosis or whatever, but get a second opinion if you feel like you want a second opinion. Or ask me any questions. I will answer anything for you. Anything about what I went through. I went through a lot. I didn't even give you I gave you a quarter of the details. But just remember, I had cancer. I'm a cancer survivor. 2 cancers. They were 2 separate cancers. It wasn't one that spread. I had a fabulous support system. My mom, my brother, my sister, my friends, my coworkers. Fabulous people. I am surrounded by fabulous people in my life. So with that, that's the end of this video that feels like I was rambling on forever, sitting on my little yoga cushion here. I wanted to be in a different spot, a little more cozy, like a little fireside chat. But maybe you want to meet, I don't know, they're sleeping here. I was going to see if you wanted to meet the doggies. I have my Gizmo. He's a Yorkie. Come here, Gizzy. Come here, baby. Come here, honey. This is my baby. Say hi. Oh, I love you too, baby. And then my mom's doggie is Charlie. Oh, Charlie and Chewy, here they are. Here's Chewy for Chewbacca. Love bugs. And then we got Charlie. Come here, Char. Charlie is staying with me. He's my mom's doggy. And something spooked him in her backyard. We think there's coyotes. My mom lives on dead-end street. We live on the same street, actually. She lives on a dead-end street, and we think something spooked him and he won't go outside at her house. So I've taken him in until we can sort of figure out what's going on and taking care of him. And then Chewy, I'm babysitting tonight because my niece went somewhere to watch the Super Bowl. So with that, you met the 3 babies, all boys, my loves, and you heard my story. If you only, well, it's the end of the video, so I'm not going to say if you only watch one video, watch this one. But if you only share one video or only tell one person about this video, even if they don't have cancer now, they could get diagnosed in 3 years, 5 years, 10 years. Their mother could get diagnosed, their sister, anybody. It might help somebody, and that's why I'm telling this story. So this is just one piece of me, one piece of get to know me. Please ask me any questions about myself, any questions about my cancer. I want to get to know you guys. I want to grow my channel and have subscribers. And I thought that this might be a nice way of, you know, letting you know one thing that's happened in my life that shaped me in a different way. So until my next video, be kind, be happy, be you, and have a great day. Actually, it's evening. Have a great evening. Thank you. Bye-bye.